Hello, everybody. For those of you who don't know me, my name is Chris McCullum. I was one of the founders of Zestlife about 16 years ago. And thanks very much to all of you for giving up your time to listen to this presentation of our 2026 gap benefits. And more importantly, thank you so much for your support. If it wasn't for you, we wouldn't be in business. And we really appreciate the support you've given us and the partnership we have with you. I'm going to take you through some of the trends and challenges we found in the health industry, particularly relating to gap cover over the years and where we're headed. And then our head of the health area, Megan Milne, will take you through the benefit changes and some benefit enhancements that we are introducing for 2026, which I think you'll find quite exciting. So firstly, let's just kick off by looking at some of the dynamics we faced with. Principally, I'm focusing now on funding for hospital treatments. Okay, so in this country, as you know, if you want to fund medical aid, if you want to fund medical treatments, it has to be done through a medical aid. So you've got your medical schemes are the principal funders of healthcare in the country. Their interests are obviously for the members, etc., but they're faced with open enrollment and community rating, which means that they have to accept everybody. They can't turn members away, and every member of a medical scheme on a certain option pays the same amount, which means that they have to have younger members in the scheme in order to create sufficient cross-subsidy to be able to keep benefit costs low, because the young effectively subsidize the old. However, what has happened, as we all know, not enough young members are joining medical schemes, which has resulted in their prices having to go up, coupled with the fact that healthcare costs are rising steeply as well. So medical aids are in a bit of a difficult position, trying to keep costs low and trying to attract members when they're fairly high liabilities. So what they've been forced to do is apply tariffs, and those tariffs are set for hospital treatments, and then also additional co-payments, which are then passed on to the members. Now, turning to the members themselves, really all members want to know is they want to be covered, that there's affordability issues, they don't want to be paying too much, and they'd like to know they're fully covered. I mean, that's really what a member's interests are when it comes to medical schemes. Then you've got your medical providers, okay? Most medical schemes have contracted arrangements with certain hospitals. So medical scheme generally covers the hospital cost in full. But when it comes to the specialists, those providers, their charges are unregulated. So a specialist can charge really any amount they choose to, and being in short supply and high demand, their charges have tended to increase way above what the medical aid tariffs are. This has obviously resulted in out-of-pocket expenses for members. Also, members looking at medical aids are faced with a quagmire of benefits, of options. A medical scheme can cost anything between just over 2,000 Rand to up to 10,000 Rand a month for an individual. And what option do they choose? How do they go about it? So members are really struggle with medical aids, obviously, and that's where you as intermediaries obviously perform a vital role. Then at the end of the line, one has got the gap cover. Okay, so when a medical aid imposes tariffs, imposes co-payments onto members, gap cover is there to cover them. However, the recent observation with gap cover is we have noticed increasing claims. And I know we say it every year, but it's getting exponentially worse and worse, largely due to more co-payments and specialist charges exceeding medical aid tariffs by an incrementally increasing percentage each year. Specialist fees are a concern. As I've said, there's certain specialists specialists can charge, they can name the fees. They don't necessarily contract with medical schemes. Medical schemes battle to contract with specialists to keep their fees down. So that is an issue. And there's greater awareness among specialists. How many of you haven't had the situation where you go to hospital and the specialist asks, or the receptionist asks, are you on gap cover? Right? Some of them, if you are on gap cover, will tailor their charges accordingly, which is not in anyone's interest except theirs, quite frankly. We've got an aging medical scheme population. Medical schemes are struggling to get younger members. Younger members are moving to health insurance, which is cheaper. And certainly within the gap environment, we are seeing an aging gap book. And that's something we have to fix, because we cannot have a situation where the older people in our gap book are paying too little, because it's only going to affect the majority of members who are younger. Medical schemes have traditionally been against gap cover in the past because they felt it led to downgrades and people then downgrading, taking out gap cover. However, what we've done, recent dynamic we've noticed is very interesting, where medical schemes are actually adopting gap cover. The reason they're doing it is they're doing some form of underwriting through their own gap cover. How it works is they'll place a fairly high co-payment on elective procedures, for example. That co-payment is then covered by gap. But then they make the gap cheaper for younger members and more expensive for older members. So what happens is younger members then join that particular medical aid option. It's a clever way of actually creating an option for younger members and attracting younger members into the scheme. So those are just some of the observations we've noticed. Within medical schemes, the trends that we've noticed are obviously escalating hospital bills. Hospital specialist costs have surged. Okay, we've mentioned that. Contribution increases have obviously gone up within medical aids. Younger, healthier individuals are delaying joining medical schemes. There's a rising chronic illness, claims in chronic illness, which doesn't really affect our gap cover, but it's something to be aware of. Obviously, if there's a rising chronic illness situation, it's going to lead to more hospitalizations, which will have a knock-on effect on us and our gap cover. Admission rates have now exceeded pre-COVID levels, driven mainly by mental health cases, which I think is very interesting, how the effect mental health is having on hospitalizations. There's been increased use of allied health services, and we are going to be bringing out a benefit now which will cover allied health services in hospital. And mental health admissions are currently the main contributor to rising admission rates, which is a sign of the times, unfortunately. So within gap cover, how does gap cover actually relate to medical schemes and to these trends? So medical schemes generally cover hospital costs in full, as they have certain network hospitals they've contracted with. If you go out of your network, obviously you'll have a co-payment, and gap cover covers that as well. But if you do not use a specialist that's contracted to the medical scheme, you're likely to have a shortfall if the specialist charges more than the medical scheme rates. And that's where obviously gap cover comes in, and that shortfall, those shortfalls we're seeing increasing. I'd like to show you some very interesting stats on that. Please bear in mind, this also applies to what is called as prescribed minimum benefits, which are about 300 odd procedures where medical aid is committed or is legally obliged to pay that claim in full. So you might think, well, if you go to a specialist and it's a prescribed minimum benefit, the medical aid is to cover you in full. However, that's not the case if you do not use one of the medical aid's network doctors and there was a network doctor available. So even for a prescribed minimum benefit like childbirth, heart failure, serious operations, if there's a network doctor available that the medical scheme's contracted with, and you decide to use your own doctor, you're still not covered in full, and they'll pay you what they call 100%, but it's not 100% of the cost, it's 100% of their tariff, which is quite a bit lower than what the specialist will charge you. Okay, I think we all know this from being gap cover providers, but that's where gap cover is obviously playing a vital role. We did a bit of a research, and we estimated that about 62% of specialists operating in the private sector are not contracted to medical schemes. So there aren't many specialists. I mean, there are more specialists not contracted than are contracted. So you might not be able to find a contracted specialist. And that limits the options. If you want to choose your own specialist and you don't have gap cover, you certainly can't afford, most people can't afford the types of shortfalls you could be faced with, which I will illustrate. Another interesting trend, and I think this is important when choosing a gap cover and you're focusing on what multiple of cover the gap cover will cover you for. Most gap covers say we'll cover you at 500% of tariff. Our gap cover is 500%, which means that if the specialist charges more than 500% the medical aid tariff, you're not covered, okay? But we did an exercise to see what on average multiples the specialists are charging relating to our claims. So in other words, what various professions like gynecologists, ear, nose and throat, etc., what is the average multiple of tariff that they charge when you go to hospital? Is it 5 times, 10 times, 2 times? And very interesting is that the majority, on average, charge less than 5 times. So gynecologists here on the top of the list, on average, charge 3.3 times. Ear, nose, and throat surgeons, 2.9. Go down the list and have a look. Anesthetists, 2.5. So what does this tell you? We are getting big claims where specialists are charging 500%, but they're the outliers. Okay. We've got to discourage the outliers, and I'll refer to them as that because they are not charging in according with the average. Those are the specialists which we have to focus on to stop this high charging when there's gap cover in place. Because on average, if you have a gap product that's going to cover you at 4 times the tariff, you should be fine. You should not have a shortfall in majority of cases. We also looked at the total claims per discipline. Okay, so in other words, which disciplines have we paid the most benefits to in terms of shortfalls? Okay, so obviously on top of the list are the anesthetists. Okay, that doesn't mean the anesthetists are charging the highest multiple of tariff, but in every operation there's an anesthetist. So we paid 40 million rand, 40.4 million rand to anesthetists over the last year for shortfalls. Bearing in mind that shortfalls, So the medical aids paid a portion, we've paid 40 million rand in terms of the shortfall. And you can go down the list and see the professions which are costing us the most. Orthopedics second, gynecologists third, and so on and so on. Right down to 1.2 million for the last one. So that's just interesting to see which medical disciplines we've paid the most claims to. This is a very interesting slide because what it shows here is out of all of our benefits. So in a gap product, it covers you for your specialist shortfalls, right? Which is, I'm going to show you now the main thing. So when a specialist charges more than tariff, it covers you for co-payments. That's the amount that you pay up front when you go into hospital. It'll cover you for a non-DSP co-payment, which is if you go and use a hospital that's not on the network. It'll cover you for that co-payment. You have to pay your medical scheme. It covers you for certain outpatient procedures, okay? And then most gap products have got a whole lot of other benefits attached. Some for specialist consultations out of hospital, premium waiver where you don't have to pay the premium if you're disabled, we'll pay the premium for you, certain cancer co-payments and cancer benefits, etc. However, those extra benefits make up a fraction of the cost of what we have to actually cover. So if you look at the first column here, the percentage of total costs for 2024 claims, 73% or nearly 74% of our total costs were paid in respect of specialist shortfalls in hospital. Now that is why you've got gap cover. You don't have gap cover to cover you with all the other little benefits, which are really just there for flavor, if I could put it that way. Okay. Secondly was the co-payments. We paid 13% of our costs went to co-payments. So between those two, it's almost 90% of the claims that we pay are for those two items. The rest of the items are so small. Out of hospital, we paid 2.9% of our costs went to that. Lump sum cancer, 2% odd. Co-payments for non-DSP, 2%. And the rest actually make up only 4%. So it really is like specialist shortfalls are the main thing. That's why you've got gap. Look for a gap provider that's sustainable, that's going to cover those specialist shortfalls, that's going to handle those big claims. Don't necessarily go and look at all the little benefits that are covered in addition to the specialist shortfalls. Similarly, we looked at how these various benefit items have increased from this year to last year in terms of percentage. In other words, how much did the cost go up? So if you look at specialist shortfalls, those costs went up just under 17% from this year to last year, whereas that's the bulk of our claims. So our cost paying for specialist shortfalls went up 17%. We can't increase our premium by 17%, obviously, because it becomes, we obviously got members' interest in mind, but that's where the bulk of our costs went. Co-payments went up 8%, roughly, 7.8%. So if you look down the column there on the right, you'll see that there are some very high percentages as well. But the fact that outpatient procedures went up 38% wasn't too damaging because only 2.9% of our total claims were outpatient procedures, you see. Same with non-DSP co-payments, went up 28%. What does that tell me? It tells me that people are starting to use non-network hospitals more. That wasn't a big cost item because although it went up 28%, it only makes up 2.7% of our cost. But it's interesting that that's a trend that we've noticed where patients are on an increasing level when they've got gap cover, not using the network hospital. It becomes difficult because if you choose your specialist, say you're having childbirth, you choose your gynecologist, they may not operate in the hospital that happen to be contracted to your network of your medical aid. And then you have to go to the non-network hospital. Thank goodness you have gap cover. We'll cover that particular co-payment, which is around, it can be as much as 16,000 Rand. It will cover. All the other benefits, interestingly, actually, the other benefits, that will be your premium waiver, your health insurance benefits that are included. The total year-on-year cost on that came down by around about 5%, but still off a very small base, very small number. So here I'm going to emphasize the point. Special shortfalls is where it's at, and co-payments to a lesser extent. But those two items is what you should be looking at cover for. If I just also mention before I go on to the next slide, is that you can see that from the average cost that I showed you of what the average multiple, that specialists charge, a product that covers you 5 times should on average be sufficient. I did make that point earlier. This slide just shows you the top 5 gap cover claims, and you can see just in some of our big claims the amount that we've actually paid, where and how little the medical aid paid for these various procedures. So, the medical aid in some instances could have paid around about 50,000 and we paid closer to 200,000. So we're paying quite a lot more than the medical aid. Well, as soon as the specialist charges more than the tariff, we are charging more. We're paying more than what the medical aid pays. So clearly these are examples of some very large claims that we have covered. One of the very concerning trends for us is the increase in what we'll call mega claims. Now, I refer to a mega claim as a claim exceeding 50,000 Rand. In the past, gap cover was covering much, much lower amounts of claims. Mega claims have increased by 143% in volume and by 165% in value on our book since 2020. So in 2020, we had 173 mega claims paid. Those are claims in excess of 50,000 Rand, which was 12.6 million. In 2024, we had 421 mega claims, which we paid, which was 33 million. So you can see mega claims went up from 12.6 million to 33 million, which is a very significant move in terms of claim cost. The age analysis there on that slide, you can see 36% of the claims were from older people, 50 to 65 years, which you could expect to happen because that's where the majority of our claims come. And as you go down in age, 29%, well, actually, that's actually wrong. 36% was 50 to 65, then 29% was actually the older people, 19% for people older than 76, etc., etc. So you can see the mega claims and the age percentages that we've got there. These are just some examples of large claims we paid. This is in our brochure. You'd be familiar with this, but it just really shows you some of the shortfalls that we faced with for fairly ordinary, normal procedures, some of them, and we actually are paying very, very large amounts in terms of shortfalls going forward. So clearly there's a growing need for gap cover, increasing claims due to the liability shift from medical aids to gap cover providers. Tariff limits and co-payments, they're always, co-payments seem to increase, and we don't know what the tariffs are, but we do notice the shortfalls getting bigger and bigger. There's a much greater awareness of gap cover now, certainly among specialists, etc. And there's obviously rising medical costs, inflation, and increasing hospitalizations. I mean, it's all pointing, unfortunately, towards increasing costs, which is the same around the world. It's the same for all healthcare funders. But we are no different in South Africa, what we faced with. So what are our challenges here to enable to continue providing our customers with gap cover at affordable premiums? We have to start pricing more accurately for age groups. We have got an aging book, and we have to be careful that we're allowed to underwrite on age, that we charge people over a certain age the right premium. So we are going to be introducing a new rule as of 2026, but only from 2026. If a member after 2026 comes of age and moves into an older age bracket, we're going to move them into that older age bracket. I don't think it's unreasonable to do that because you're being charged for the risk you are. You've been charged the appropriate premium, and we are not disadvantaging the rest of the book by creating a cross subsidy between the young and the old. So we're going to be doing that, and Megan will give you a bit more detail on how that will happen. We have to manage prescribed minimum benefits as best we can. We have a team that makes sure the medical aid pays the prescribed minimum benefit when they should, and medical aids are paying in full. And that we save quite a bit of money each year doing that. So please, if your client does have a claim and it's a prescribed minimum benefit and we have to investigate it, please understand we're just trying to establish whether we need to pay it or whether the medical aid should be paying it. Is it a gap claim or is it a medical aid claim? Okay? And we have to really focus on that. We've got to try and manage high cost charges and fees. And as I've showed you, it's the outliers that are charging more. On average, doctors are not charging. We're quite happy to pay tariff amounts of 3 to 3.5 times. When it gets to 4, 4.5, 5 times, I think it could be regarded as an excessive charge. And we do negotiate with those specialists. We try and get them to bring their cost down. We're successful in some instances, but unfortunately not in all of the instances. I think it's important to avoid offering gap cover with higher tariff multiples because, as I showed you, you're going to be fine with 5 times cover. If you go and cover an extra 5 times or 6 times or 7 times, the effect that will have on the outliers is that they will then charge 6 times or 7 times. That is just going to push up the overall cost and create an environment which eventually becomes too expensive. So we have to manage, we have to be work together and be sensitive about this and try and manage healthcare costs by not offering higher tariff multiples on gap. The good news is we've realized that there's a need to attract younger members. We've realized we've got an aging book, so it's difficult to reduce the premium or on our existing options. But what we'd like to do and what we're going to do during the course of next year, in the first quarter of next year, hopefully, is bring out a product which is going to be reasonably priced for young families. Okay, it's going to have a reasonably priced premium, probably for families under 40, and we'd then like to really try and attract those members to our gap cover, which I think across the board would actually have a positive effect for everybody. So look out for that. It's going to be coming during the course of next year, hopefully in the first quarter. Okay, these are our premiums for 2026, probably all that everyone's been waiting to see. So you can look down the line there and see we've kept the same age bands, we've kept the same products. Optimal gap cover for people younger than 35 is still now coming at 276 Rand, and our family option for members under 65 is coming in at 784 Rand per month. Okay, so the average increase for 2026 is 9.9%. But bearing in mind, in 2025, we actually had a fairly low average increase of 7.3. So we want to try and avoid as well having too low increase this year and having to put too high increase next year. And we hope to also come in with this new product in the beginning of next year, which will provide a reasonably cheap premium for families under 40, which I think could be very popular. Okay, I'll leave that slide on a bit so you could see what those premiums are. Okay. So thank you very much. That's my bit over. I'll come in at the end again to conclude, but I'm going to now introduce you to Megan Mill, who is head of our healthcare area, and she's going to take you through all the new and improved benefits that we're going to bring you for 2026. Thanks very much.
Hi everyone, thanks for joining us. I'm Megan and I'll be taking you through the 2026 new and improved benefits. Okay, so the first one we're going to start off with is our out-of-hospital procedure list has grown. So this has been extended to include cover for skin grafts, laser eye surgery, childbirth in a non-hospital setting, hernia repairs, quite a few more procedures that have now been added. So our list is just over 60 procedures for out of hospitals. We've added a new benefit, as Chris mentioned earlier, for allied professionals. So this benefit covers the shortfall between what the allied professional has charged and what the medical scheme has paid for in-hospital care following an associated in-hospital procedure. This is limited to 2,500 Rand per policy per year. Some of the allied professionals that are covered are chiropractors, podiatrists, speech pathologists, clinical technologists, and you can see the rest of them on the list here. But I think that this is a really nice and valuable new benefit that we are now offering. Another really exciting benefit enhancement that we have made for 2026 is to our MRI, PET, and CT scan benefit, which comes into play once your medical aid sublimit has been reached. Previously, we imposed a 3,700 limit per individual per year. This has now been extended to an overall policy limit of 16,000 Rand, subject to a limit of 5,000 Rand per scan. Treatment for accidental injury. So this is an enhancement on our existing benefit, where there is cover for emergency treatment after an accident has been extended to include treatment by a GP if there is no registered hospital casualty facility within a 30-kilometer radius. So this cover is provided up to 26,700 Rand per policy per calendar year. Another enhancement on our existing benefit. So this is cover for emergency treatment for children under the age of 11. Previously, you were only covered if you went there after hours, but this restriction has now been removed. Cover is provided up to 2,950 Rand. Internal prostheses and artificial joints. We've added pacemakers to this. So there is cover for shortfalls on pacemakers are now included at 8,000 Rand per person per year. And this is in addition to shortfalls on cardiac stents and intraocular lenses. Just a reminder that these benefits don't reduce the overall annual limit of 46,000 Rand for internal prostheses. Health assist benefits. Previously, it was called health insurance benefits, so we've just had a bit of a naming convention change. It's now called health assist benefits. And under this option, there's cover for trauma and bereavement cover. So this benefit has been extended to include cover for trauma as well as bereavement counseling needs following being witness to or subject to an act of violence, or due to a traumatic accident or loss of an immediate family member. So this benefit covers up to 950 Rand per session with an overall maximum benefit limit of 32,000 Rand. Cancer assist cover. So we've changed our cancer diagnosis benefits slightly to provide a wider variety of cover. It's now a tiered benefit depending on the severity of cancer diagnosis. So it is now 8,000 Rand on first-time diagnosis of stage 2 cancer, local and malignant, and then 20,000 Rand for more severe cancer where it's regional and malignant. Additionally, if you have successfully claimed 20,000 Rand, we will pay a further 15,000 Rand if your medical scheme has spent more than 200,000 Rand or more on oncology treatment within 12 months of diagnosis. Age cap removal. So this is an enhancement to some of our existing benefits, but the age cap of 65 has been removed from our medical scheme and gap premium waiver cover and the accidental death and permanent disability benefits. So those benefits will still apply to members that are over the age of 65. Violent crimes assist cover. So this is a new benefit. where it will double the accidental death and permanent disability benefit of 55,000 Rand to 110,000 Rand should something happen as a result of a violent crime. Age band shifts, I'm going to spend a little bit of time speaking about this. Chris touched on it briefly, but just to give a little bit more detail around it. So policyholders will shift to the next age-based pricing bracket from January 2027 if they or their dependents reach the age limit in 2026, so next year. This will continue to be reviewed each year and implemented each year. Okay, so just to give some examples on this one, a member who turns 65 in 2026 will be moved to the 65 plus age band on the 1st of January 2027. Similarly, a member who turns 55 in 2026 will be moved to the 55 to 64 age band on the 1st of January 2027. For those of you that have clients on Optimal, if a member turns 35 in 2026, they'll be moved, given the choice to move to Universal or Essential. What's quite important to note here is if you've got clients, and there are quite a few, members already older than the 65 aged bracket and paying the under 65 base premium will not be moved to the over 65 bracket premium. Members already older than 55 but paying the under 55 base premium will be moved to the over 65 bracket premium the year following their 65th birthday. This applies based on the age of the main medical scheme member and any of their dependents. If you've got any questions or any queries, please reach out to your BC and their contact details will come up on the slide at the end. Okay, I'm going to touch a little bit on our employee group gap offering. So in the last few years, we've been quite aggressive in our pricing and tried to deliver competitive group quote premiums. So all groups will receive personalized quotes with substantially discounted rates. If you've got any groups that aren't on gap cover, or perhaps they're already on gap cover and they're looking to move providers, simply reach out to your dedicated broker consultant for quotes on your groups. A reminder that the minimum size for both compulsory and voluntary groups to qualify for preferential rates for both gap and dental, I'll touch a little bit on dental in a bit, versus individual rates is 10 employees. This is quite a nice, exciting new benefit. It's a baby bump benefit. It's only available for our groups, so it will not be included in our retail or individual policies, but for groups only. So we'll be introducing the baby bump benefit, which pays out 2,500 Rand to assist with pregnancy costs. In pregnancies involving twins, triplets or more, this benefit is paid per fetus. So if a member has twins, the benefit doubles and it'll pay out 5,000 Rand to assist with any pregnancy-related costs. Okay, this slide is just to give you an idea of the type of annuity income that you can earn. So a reminder that commission grows annually with each premium increase, which is usually higher than inflation, and the product has an extremely low lapse rate. So to give you an idea, if you've got 10 clients that are on gap cover with us, you will earn approximately 1,200 Rand per month. If it increases to 100 gap policies, you're looking at earning around 12,000 Rand per month. And if you've got 500 gap policies, and we've got a few intermediaries with big books, that is close to 60,000 Rand per month. Okay, we've really tried to develop as much broker support as possible in terms of new business that you write and also servicing your existing clients. So we've got a broker portal, we've got online resources, a gap comparison tool, medical aid shortfall tool, online applications. We can assist you with referrals if that is the method that you would prefer, and BC support. So if you scan the QR code on the screen, it'll take you to our advertising resources page. And here you can download some images and videos. And it's a way that you could generate your own leads on your social media platforms. Our broker portal. So if you would like access to our broker portal, you can send your details to info@zestlife.co.za or contact your BC and we can set it up. But in essence, the broker portal helps you with policy maintenance, and there's a few items there. But I think what everyone's interested in is claims. So you can log on to the portal, lodge a claim for one of your clients, upload the relevant documentation, and you can also view the progress of the claim throughout the process. Once confirmation of whether it's been paid or rejected, you can also have a look at that. Okay, the online application tools that I mentioned earlier, they are actually personalized online applications. So they will have your details in the application that can be sent to your clients. Once they have submitted the application, the details get sent back to you. So they're personalized online application forms that we can develop. The medical aid shortfall tool, and this is actually one of my favorite sales tools, because you can easily go in here when you're sitting with a client and select their medical aid. So here's an example: Discovery, Coastal Core, and it will automatically show you the potential shortfalls that your client could face on that specific medical aid option. And those shortfalls could be covered by gap cover. So it's a really nice tool for you to be able to see what the shortfalls are, but to also show your clients. So you can scan the QR code and it'll take you to the medical aid shortfall tool. Okay, the referral program that I mentioned earlier, so you can either choose whether you'd like to conclude and do the sales fulfillment of gap policies. Alternatively, we have developed an option where you can send referrals through to us. We do the sales fulfillment and you earn referral fees. So we've seen a nice steady growth in referrals from intermediaries in 2025. We're quite proud to say that the referrals we've received have a high conversion rate. And the products and services that can be referred to us are obviously gap cover, our dental cover product, and our HealthMax medical aid services. We've also made sure that the referral program is flexible and personalized to you. So if you would only like us to sell gap cover to your clients, that's perfectly fine. Or if you would like us to handle the medical aid advice portion of it and you do the gap sales fulfillment, all of this is possible. When you sign up as a referring agent, you will select your preferences and we will follow those rules when speaking to your clients. We've also got an easy online lead submission, which is on the next slide. So you can submit your leads once you have signed up as a referring agent, either on the Zestlife or Liberty branded portal. Once those leads come through, they get allocated to one of our specialists, and you will receive weekly updates on the status of your leads. Once we have successfully sold either gap or dental or whichever product you've selected to your client, you will earn a once-off referral fee, which is paid after the first premium is successfully collected. Here are our referral fees. So you can see for gap and dental cover, it's 3 times the premium sold. So to give you an idea, you could probably earn on average 1,500 Rand for a gap policy that we sell to one of your clients. For dental cover, it's about 800 Rand. And for our HealthMax medical aid broker services, it's 460 Rand. Okay, I'm just going to quickly touch on dental cover for those of you who aren't aware, but we do have a dental insurance product. We've got 2 options, Superior and Smart. Superior is our most comprehensive dental product, or dental option rather, and then Smart is a little bit more affordable, but covers the most frequently incurred dentistry treatment costs. The type of benefits that are offered is cover for general dentistry treatment. So that's your checkups, your cleaning, if you've got a chipped tooth, fractured tooth, dental emergency, dental abscess. There's a whole host of benefits that are covered under the dental product. And we pay out a stated rand amount if your client experiences any of these events. Here are the dental premiums for 2026. So you can see under the superior option, for individuals, it's 325 rand per month. For a family under superior, it's 655 rand. And that is for the policyholder, spouse, and up to 4 children. So if you're a family of 4, you will pay 655 rand. For the smart dental cover, it's 168 for a single individual or an individual policy, and for family policy, it's 378 rand. Okay, I'm going to leave up this slide. It's got our contact details, but thank you very much for joining us. I'm going to hand over to Chris, and he will give a few closing remarks. Thank you very much.
Okay, thanks very much for listening to us. Our contact details are up there for a really good reason, and that is that we pride ourselves on dealing with you directly. Please don't agonize if you have a problem with a claim or anything. My contact details are there. I frequently deal with queries, and I'm more than happy to go the extra mile to sort it out for you and your client. So please contact me as opposed to agonizing over a particular issue that you may have. Similarly with your BCs and Megan, they're also very much there for you. So just to conclude, thanks again for joining us. Thanks again for your ongoing support. And we look forward to continuing working with you for 2026. Thanks very much.